Mohs surgery is a great option for a skin-sparing technique for treating skin cancer. Here are some questions that you might want to ask your doctor about before the procedure. Hi, my name is Dr. Jordan Carqueville. I am a Mohs surgeon and cosmetic dermatologist. If you're new to us, feel free to subscribe to the channel and let's dive in. The first question is, what should I expect during the procedure? So Mohs surgery is a skin-sparing technique to remove your skin cancer. And this can take anywhere between 3 hours to a full day. Basically, you come into the office, we mark where the skin cancer is, we numb up the area, we remove that piece of skin, and then we carry that piece of skin to the lab in the back room of our office where the technician is. The skin gets processed on a slide, and it takes about an hour. And then your surgeon, your Mohs surgeon, is also the pathologist, will look at that slide and determine if the margins are positive or negative. If the margins are positive, then the surgeon will go back and take a little bit more in the direction that the cancer or the tumor is growing. If it's negative, the surgeon gets to close you on up. So the surgeon is not only the pathologist, but also the reconstructive surgeon as well. If it's positive, then we take a little bit more and it's another hour of waiting for that laboratory to process the tissue. So that's why it takes some time. Bring something to do, eat breakfast, bring snack, and we'll do the best we can to get you out of there cancer-free. The next question is, what type of scar can I expect? The type of scar that you get after a Mohs surgery or removal of any skin cancer for that matter is going to depend on the location on the body, and it's going to depend on how big that tumor ends up being. We don't know how big it's going to be until we really get in there. So the scar will depend on the closure, and the closure is going to depend on the location and size of the growth. So the earlier you get your skin checked and it's cancer detected, it usually means smaller the scar. So get your skin checked. How long does it take to heal from this procedure? Healing time from any surgery is going to depend on the location and the type of closure that was performed. Typically, Mohs surgery is reserved for the face, neck, hands, feet, maybe the front of the leg. These locations, we usually take sutures out in about 1 week if it's on the face. If it's an area where there's lots of tension or movement, we usually take the sutures out after about 2 weeks. Sometimes, if you're lucky, we could use dissolving sutures. The healing time can take up to 6 months. Sometimes we even say a year. But scars take time to remodel and they go through processes of improvement over many months. So the final result typically will be 6 months to a year. If you have concerns about your scar, especially in our practice, we have many options. We have every laser you need to optimize a scar and make that scar blend and fade away as much as you want it. The next question is, are there any potential risks for this surgery? As in all surgeries, there is a risk of infection, scarring, bruising, bleeding. Those are pretty much the main things. We use clean and sterile technique to avoid infection. We have tools that help hemostasis, which means to stop the bleeding and the subsequent bruising. And then, of course, we always say that anytime you have a cut into your skin, whether it's a traumatic cut or a surgical cut, you will have a scar. But as I've mentioned earlier, we have many tools to help optimize scars and make them not so bad. You may have your Mohs appointment scheduled by now, and it's going to be great. It's good to get this over with and just get to be cancer-free. Fortunately, most skin cancers are curable. So the patients that leave our office on that day walk out cancer-free.